Welcome to our talk today. So we are joined by our guest, Dr. Nicholas Fox. My name is Deidre Moss. I am the host of Can We Talk? I'm an educator, motivator, and a talk connoisseur. In our session today, we will talk about breast cancer awareness. As October is recognized as Breast Cancer Awareness Month, we want to talk about what that means to our community. So today, again, we welcome Dr. Nicholas Fox, the director on the board of the Cancer Society. The director of the board of the Meta Center, And so Dr. Fox will help us to dissect this topic. And so I will turn it over to him to introduce himself. Dr. Fox.
Hi, hello, Bahamas. My name is Dr. Nicholas Fox. I'm one of the co-owners of the Meta Center clinics. I'm at the Collins Avenue branch. And of course, we have the Prince Charles branch. I've been around for a while. So a lot of people know me. I'm also on the Cancer Society board. I'm one of the directors, and I'm also a cancer survivor. I survived colon cancer stage 3 9 years ago, and I'm living to tell the tale. I use my experience as a platform to inform people about cancer and to let people realize that the big C does not necessarily mean a death sentence. As you are aware, October is Breast Cancer Month, and being a part of the Cancer Society and an executive board member is to educate, inform, and let the general public know about cancer, all the different types of cancers, and to provide information to the general public about cancers and the treatments and what is available in the Bahamas. Now, as a board member, my job is to determine and implement policies and make decisions to ensure that these policies are in place and carried out. Attend monthly meetings, quarterly meetings, and to go out to the public, like I said earlier, and represent the Cancer Society to bring awareness and for fundraising. As you know, the Cancer Society is a non-profit organization. So we depend on the kindness and generosity of institutions and corporations and the general public to donate so that we can continue our service to the Bahamian people. We also educate and inform people about the Cancer Society and the role that it plays in the society. So basically that's what I do as a board member. Let's talk about breast cancer. There are some startling statistics in this country. As you are aware, breast cancer is a type of cancer where cells in the breast tissue divide and grow without normal control. It is widespread in this country. When I say widespread, it is probably the #1 cancer in women in this country. We have a very high incidence of breast cancer in this country. And that needs to be addressed, and it is addressed. And we try to do everything to educate and inform people to have proper screening for early detection and treatment. As you know, breast cancer is a random disease striking men and women. Yes, I said men. Men get breast cancer too, okay? Of all ages and races. It is the most prevalent cancer in the world today, with about 1.3 million people being diagnosed annually. The exact cause of disease is unknown, but there is hope. Thanks to heightened awareness, early detection through screening, improved treatment methods, and increased access to breast health services, people have a greater chance today to survive cancer than ever before. Here is some startling Bahamian data. Health officials estimate 300 to 500 new cases of breast cancer being diagnosed in the Bahamas every year. 48% of those women that are diagnosed with breast cancer in the Bahamas are under the age of 50. Just when you're in the prime of your life. The average age of diagnosis in the Bahamas is 42, whereas compared to the United States, it's 62. 44% of Bahamian women with breast cancer had stage 3 or stage 4 of this disease at the time of diagnosis. In other words, Bahamian women usually present pretty late. And I'll explain why that is later on in the show. What this means is Bahamian wives, mothers, daughters, sisters, friends are finding out about their breast cancers very late, but dying a lot younger. Among the women who die from breast cancer in the Bahamas, 43% are under the age of 50 at the time of their death. Now that's startling for me. I lost my mother to breast cancer at the age of 54. And I was devastated. So you can't imagine the effect the diagnosis of advanced breast cancer has on a home, especially where there's a mother and she has many children. It's really devastating. In addition, it is estimated that a full 23% of Bahamian women diagnosed with breast cancer carried a Bracha gene. This is very significant. They carried a Bracha gene mutation. And an issue being investigated by Dr. Judith Hurley at the University of Miami, who Research Komen has funded since 2008. So they discovered this gene. It's very prevalent in this country. And that's one of the screening tools that we use when we ask women about their family history of breast cancer. So basically that's the statistics for breast cancer in a nutshell. Would you like to add anything, Ms. Moss?
Yes, definitely. And I want to thank you for sharing those statistics. And you talk about there is a gene that a lot of Bahamian women carry. And is there any reason as to why this gene is so prevalent?
Well, genetic research has shown that Bahamian women with breast cancer have the highest prevalence of an inherited gene in the Bracha gene. And we have the highest the prevalence in the world. Unfortunately, we like to be number one. For some reason, I don't know why, but we have this gene and we have the highest prevalence in the world. In fact, more than 25% of women with breast cancer have this inherited predisposition. Carriers of this mutation can now plan preventative strategies. It's a good thing and a bad thing, eh? If you get tested for it, you have it, then you can do prophylactic measures, either have your breast removed or have constant follow-up with your doctor for early detection, or remove the breast so you don't develop it at all. So it's a good and a bad thing. More and more young women are now coming forward for prophylactic bilateral mastectomy or removal of both breasts before they are diagnosed with reconstruction. In this day and age, you can have your breast reconstructed to look like a real normal breast. So having a mastectomy or having the breast removed is not an issue anymore. A lot of women are very concerned when they present to my office and I diagnose them with breast cancer. And they're like, oh, but doctor, my husband may not see me the same. You can have your breast reconstructed, and you can get them to the size you want, the shape you want, the firmness you want. So having your breast removed in this day and age is not a significant problem like it was in the past. They are also aware that if they have their ovaries removed at the age of 35, once you've finished having your kids, then it will give them a 70% protection against breast cancer and eliminate the risk of ovarian cancer, which is also associated with this Bracha gene abnormality. Now that's a lot to swallow in a short space of time. What does this all mean? Well, when you go to have your screening done, the doctor will ask you about your family history. And in asking about your family history, he or she can determine whether you need further studies to see if you have this Bracha gene, and you can be tested. And then you can make the decision. The doctor's not going to make the decision for you, but you can make this decision as to whether you're going to be extreme and have both breasts removed and maybe your ovaries removed, or you're just going to have regular annual screenings like mammograms, ultrasound, even breast MRIs to determine if there's an early form of the disease, and then you can attack it from there. Any comments, Ms. Moss?
Yes, definitely. So I wanted to ask you, if I'm someone, let's say I'm a relatively healthy person. I've never really had an issue with my breasts, but I just want to come in to see, if test myself for the gene, that there's a high prevalence of. At what age, would you recommend young women, and then you even spoke about men, but at what age would you recommend a person come in to just get tested?
Well, again, that all depends on your family history. If you have a significant family history, where Grammy had it, Mommy had it, your sister had it, then I would start at an early age. Let's say I would start to have ultrasound. Remember now, when you're young, the breast tissue is dense, so a mammogram won't do. Usually we recommend mammograms at the age of 40 when the breast is not as dense. But if you have a family history, then I would recommend earlier. Sometimes as young as 25, to get screened with an ultrasound, a breast exam, etc. What do we look for when we talk about breast cancers? Okay. First of all, we talk about breast self-examination. I always tell women, just stand in the mirror with your hand in your kimba and look at your breasts. Obviously, one breast will be bigger than the other. And you look at your breasts, but they should be symmetrical, basically the same size. The nipples should be the same, everything. If you notice any changes in the skin, like if it looks like an orange peel, that's called peau d'orange, that's classic of breast cancer. If you have any discharge from the nipple, like a bloody discharge, a creamy discharge, then see your doctor about it. If you find a lump, of course, see your doctor about it. Not all lumps are cancerous. Just let me say that. Not all lumps are cancerous. So if you find a lump, don't be afraid and think cancer automatically. Discuss it with your doctor. Let him do a breast examination. If he determines it may be suspicious, he may decide to do a needle biopsy where they stick a needle in the tumor and suck out some cells and make a slide and send it to the lab. The cytologist or pathologist will look at the lab and determine if it's malignant or benign. Once that's determined, if it's malignant, then you will be referred to an oncologist and possibly a surgeon. If it's benign, then we would recommend serial follow-ups of either ultrasound, mammogram, whatever, to follow this tumor to see its progression and to see if it changes. Now, of course, there are a number of reasons why we may develop breast cancer. Family history being one, we spoke about that. Gene mutation, late childbearing, women who wait till they're 40, 45 to have kids, early menstruation and late menopause. And one of the biggest causes is obesity. Obesity is a problem. Go on. Sorry.
Oh, the thought. Wow. So can I ask you because we in a generation where women are waiting a little bit longer to have kids and moving forward in their career, so that can play a factor as well?
Yes, it can.
Oh, wow.
And that's why we strongly advise to get your annual physical and your breast exam and to do proper screening to detect any early cancer. Once it's detected early, then there's usually 100% cure rate. Another cause or contributory factor to breast cancer is prolonged use of contraceptives. I have women who are 40, 45, they're still on birth control. And when I tell them, you're not supposed to be on this because there's a high risk of developing breast cancer, they are totally surprised and startled. But usually oral contraceptives should stop at the age of 35 to reduce the risk of breast cancer. Also, hormone replacement therapy. Once you go through menopause, you feel down, you feel bad. Women want to feel young again. They want to feel sexy again. They want to have a good sex life after menopause. So a lot of them choose to go on oral hormone replacement therapy. And sometimes, depending on the dose and how it's given, this may contribute to breast cancer. Of course, drinking and smoking also contributes to breast cancer. Now, one topic I want to touch on here, one of the risk factors, major risk factors that's being associated other than the genetic Bracha Gene one, is obesity in this country. As you know, a lot of Bahamians feel that being solid, as we call it, is sexy and the men like them like that. And they want to put on weight, and a lot of them go to Dominican Republic to have their butts enhanced and their breasts enlarged, not knowing that this contributes to breast cancer. Obesity is not a good thing. Not only does it contribute to breast cancer, it also contributes to other non-communicable diseases like diabetes, high blood pressure, elevated cholesterol, and just shorten your lifespan. So we encourage people to eat healthy, to exercise, and to and just to think positive and do what they're supposed to do. Reduce the smoking, reduce the drinking. Speak to your doctor. Get to know your doctor. If you have any questions, just ask your doctor, and he can inform you as to what to do and how to go about getting screened for breast cancer. Any comments, Ms. Moss?
Yeah, I just wanted to say, I know persons may be listening, and if you have any questions, because I was checking the comments, if you have any questions for Dr. Fox, is it okay for them to present their questions in the comments?
Yes.
Okay. And Dr. Fox, you skimmed over so much important information. This is information that we need to talk about. You talk about contraceptives being can you please just talk a little bit about that, please?
Yes. Birth control pills, which contain estrogen, and progesterone. As you know, there are two hormones, female hormones, there's estrogen and there's progesterone. We find that women who tend to take birth control pills that contain estrogen or take estrogen unopposed, like in hormone replacement therapy, they end up with, some of them end up with breast cancer. So we discourage that. But a lot of women are not aware that after the age of 35, they should not be taking oral contraceptives. There are many other means of contraception that does not involve hormones, like an IUD coil, the 3-month shot, which is progesterone, the diaphragm, and condoms. So women have a choice, and they need to be informed in order to reduce the incidence and prevalence of breast cancer in this country.
Wow, I'm just, really surprised at, some of I think you're skimming over it, but this is so impactful because you're talking about us being number one, Dr. Fox, number one. Wow.
We are number one in this country in so many things, and I don't know why. Diabetes, HIV, why we like to be number one, I don't know. I think it has to do with education. As you know, Bahamians don't like to read. They prefer, and this vaccine campaign is a classic example. They prefer to listen to the neighbor whose friend had this or whose cousin had that, and they go by that instead of listening to the educated, informed professionals. We spend an eternity in school to acquire and attain all this knowledge. So we're not going to lead you wrong. We're not gonna pull the wool over your eyes. We are just doing what we were taught to do, and people should listen to us. We benefit nothing by leading people wrong. Yes, I think education is the key. And like I said, Bahamians don't like to read. The Cancer Society tries to provide information for people about all types of cancer, not just breast cancer, but it is heightened in October because October is our Breast Cancer Awareness Month. So we do campaigns like this, all kind of talk shows, lectures to businesses. We have guest lectures at the Cancer Society. So people can tune in and listen and become educated and informed about, the significance of having your breast examined and to get proper screening to prevent or detect early cancer so they can be treated and eradicated 100%. Again, and like I said, a lot of women present late. I see women present so late in my office. The other day I saw a lady, she came in with shortness of breath, and she didn't tell me she had a tumor or a lesion on her breast. So I assumed she had COVID, and she showed me a COVID test and it was negative. I examined this woman. I couldn't find any reason for a shortness of breath, but I noticed one lung was not getting in any air. So when I proceeded to examine her, when she raised up her blouse, I was horrified. The tumor had already eaten down to the muscle of the chest.
Dr. Fox, are you saying that this patient did not inform you of this?
No.
Oh, wow.
And the lung was gone. I mean, completely gone. And she started to cry and she was like, I was just afraid. And that's the problem here. A lot of women are afraid once they detect a lump, they keep it to themselves. They're afraid to tell people. They're afraid to tell their doctor. Why, I don't know. We have this stigma about having cancer in this country, and that needs to be removed. There's nothing wrong with having cancer. Nobody goes out there and asks to have cancer. So if you discover that you have a lump, go and have it checked out. It may not be cancerous as well as it may be. The thing is, if you detect it early and you get it checked out early, you can be cured 100% without having to go through chemo, radiation, etc. Once the lump is removed, you may not need any further treatment. However, when you present late, it becomes a lot more expensive to you, and your chances are decreasing rapidly as the day go by. So we encourage women to please, and men, to please get screened on a regular. I also find that with men, once they present, it's very late. The two patients that I've had with breast cancer presented very late, and they died because of metastases to the lungs. Metastases means when the cancer spreads. They died because of metastases to the lung, and by the time they presented, there was nothing anybody could do. And it was sad because they were married young men and they had kids. And this is the problem that happens when people choose to be, I say, selfish and not take care of themselves and get themselves checked out. They leave loved ones that they hurt and scar forever, and they leave kids behind who have to fend for themselves. Because a lot of Bahamians don't have insurance, so when they die, there's nothing. People have to find money to bury them. People have to find money to pay the hospital bills. And then it becomes overbearing for the family. And that's why it is so important to have proper screening and early detection. And that's one of the roles of the Cancer Society. You know, we go to the family islands, all the family islands on a regular, well, because of COVID, we didn't, but we go to the family islands and we do the national pap smear and breast screening campaign for women and the prostate for men. And we do that annually. We send doctors to the islands and they do breast examinations, and those who need mammograms are sent to Nassau. We do the pap smear. If any pap smears are abnormal, then they are sent to Nassau to be dealt with. I just want to deviate here and talk about pap smears for 1 second. We still have a high number of Bahamian women dying from cervical cancer. This is embarrassing and egregious. Why? There's a vaccine to prevent this, okay? So there's no need for us to have significant numbers of women dying from cervical cancer anymore in this country. And besides, a pap smear, if it detects the cells as they are starting to change, you can have a simple procedure where they put some stuff on the cervix and it kills off the cells, and that is gone, over, finished and done. You don't have to do anything else. But we wait and we wait and we wait, and by the time we present to the doctor, it's too late. And the only thing the doctor can do is, you know, wish you good riddance. And I can't understand why it is like this in this country, but you know, this is where we live. This is what it is. And the role of the Cancer Society is to discourage this and to try to get people into the doctor so they can have pap smears, so they can have breast exams, so they can have prostate exams to detect any type of cancer early so it can be dealt with and eradicated.
Dr. Fox, you've presented some vital information. I'm appreciative that you have taken the time to share this knowledge and insight. I was looking at the comments. I just want to recognize Ms. Pitta from Jamaica. Hi, Vivian. Thank you so much for listening in. Kenny Sweeting said it's very informative. I want to thank you guys for listening. And Dr. Fox, I also want to thank you for reiterating that it's not just women, but men. our men also need to be, consistent with getting their screening as well. So I want to thank you for reiterating that. That's very, very important. So thank you. Thank you for sharing that.
Yeah. Another thing too is, again, obesity. You see a lot of Bahamian men, they have these big bellies, and they develop breasts. This creates a platform for hormone production in men, female hormones, which stimulates the breast tissue, and can cause tumors to develop. It also contributes to impotence in men and erectile dysfunction. So obesity in this country is a huge problem. And until we grasp the concept that being overweight and heavy is not a good thing, and we restrict our fat intake and modify our diets to eat healthy, we will continue to have these types of problems.
Thank you. Thank you for sharing that important point. Just want to recognize Laverne Walgoose. She's saying, good job, Dr. Great job, Dr. Fox. I just want to recognize her in the comment as well. And you talk about the Cancer Society. You kind of went over quickly, but I want you to reiterate really, the role and responsibility as a director on the board of the Cancer Society. Just reiterate that for us again, please.
Okay. As a director on the Cancer Society, my job is to determine and implement policies and make decisions to ensure that these policies are in place and are carried out. We attend monthly and quarterly meetings, and another job of ours is to go into the public and represent the Cancer Society to bring awareness to early detection and treatment of cancer, to educate and inform people of the Cancer Society and what we do as a body in this society. Also for fundraising, as I said earlier, we depend totally on the kindness of people's hearts to operate. Our initiatives and objectives, radio and TV shows, Zoom meetings with breast cancer survivors in females and males, various talks at business places and churches, monthly Zoom meeting with oncologists on the genetics of cancer and treatment options. Fundraising events, like I said, that's how we survive. We have a virtual auction coming up on November the 13th. We have a virtual fun walk on November the 20th. Our biggest fundraiser is our ball, which we had a virtual ball this year, which actually turned out amazing. I was so amazed, and it was so good. It was just as if we were there in person. Everybody had a good time, and we did quite well in terms of fundraising. I asked people to donate to the Cancer Society. A lot of people think that they have to donate $500, $600, $1,000. No. If you have $5, $10, $20, excuse me, anything helps. Anything helps. And I just want to say that we have a cancer center at the Cancer Society on off Collins Avenue, where there's a thrift shop. You can come and purchase goods. You can call the Cancer Society if you have questions. And we have a cancer caring center that plays an important role for family islanders who are diagnosed with cancer and have nowhere to stay. So they can come to Nassau and they can stay at the Cancer Caring Center and do their treatments and be in comfort away from home. Because I'm sure it's quite scary coming from the family island and you have nowhere to go, nobody to depend on while you're doing your treatment. The establishment of Cancer Awareness Month is observed in the month of May, where we talk about and highlight all cancers, not just one particular cancers. And we do extensive educational activities. We encourage healthy lifestyles through the media. And like I said, in May, this climaxes with our annual Cancer Society Ball. which, like I said, the virtual one was amazing. And hats off to the organizers and the planners who executed that, because it came off beautifully. Again, the creation of the successful National Pap smear breast screening for women and prostate screening campaigns for men in the Family Islands. And all of these are free, no charge. And creation of the Family Island mammogram screening funded by the Ride and Run for Hope Foundation. So people in the Family Island who need a mammogram after we do the screening, they can come to Nassau and get a free mammogram. We also have a successful treatment assistance fund that provides a maximum of $1,500 to qualified cancer applicants. And this is toward treatment and testing expenses. This is also funded by Ride and Run for Hope Foundation. So we also finance annual trips for the children with cancer to attend Camp Good Days in New York. And we have the adult support group, ages 40 plus, with people of all types of cancer. And we meet the second and fourth Thursday of every month. And then we have the Freedom Kids support group, age 2 to 17 years. And this group meets quarterly. There's also a partnership with Us Too for men that would provide invaluable emotional and moral support for us, for men that have been diagnosed with cancer. Now, this is important. Our Cancer Caring Center is a 10-room facility or a home away from home for cancer patients from the Family Islands that are undergoing cancer treatment in Nassau. Presently, the Society is in a $3 million cancer caring expansion project that we anticipate will become a reality in the very near future. Again, this cannot be achieved if we don't get financial contributions or donations. There will be an additional 16 rooms for cancer patients, daycare for persons that reside in New Providence, and hospice care. Again, I would like to stress our yearly fundraising events, the Stride for Life Run and Walk, the Cancer Society Annual Ball, our annual raffle, which we did not have this year, obvious reasons, our annual bingo night, and our upcoming event, Love Lights a Tree. We have this is on November the 26th. We have a big Christmas tree in Kelly's yard, and you can come and purchase an ornament for some loved one that died from cancer and place it on the tree. I think that's a wonderful idea for people who want to remember a loved one, and just light it up during Christmas on the tree. We have our virtual auction, which I would recommend people to attend on November the 13th, and our virtual walk on the 20th of November. So we have a lot of stuff going on to raise funds and to keep the Cancer Society in the forefront of people's mind, so that they can be aware that if they have questions about any type of cancers or anything regarding cancer, they can just pick up the phone and call the Cancer Society. The telephone number is 323-4482 or 323-4441. We also have a thrift shop. So if you have stuff that, that's in good shape and good quality, and you don't want it or need it anymore, you can donate it to our thrift shop. And we raise funds like that as well. And again, people can just come to the Cancer Society and donate whatever. We appreciate the support of the Bahamian people, and we look forward to continuing to provide all the services that we do for the Bahamian people.
I mean, you talk about there's so many initiatives that the Cancer Society has, is working on and it is doing, and that's excellent. I want to go to the comments. I want to thank Ms. Storr, Erin Storr, for helping to facilitate this session. Thank you so much, Ms. Storr. She's saying, yes, a world of information. Women need to not be afraid to tell the doctor if they have an issue. Early detection saves lives. So that's very important. And Christine Chin, thank you, Ms. Chin, for listening in. She says she's here with Dr. Shea, president of the Cancer Society. Thank you so much, Deidre, for having Dr. Fox. You're doing an awesome job. Let's hope people can watch the recording afterwards. So definitely the recording is available. And Dr. Fox is sharing a lot of information that some person, we need this information. We need to know. So I want to thank you again, Dr. Fox, for sharing. And I want to talk about awareness as well. How would you rate the levels of awareness of breast cancer at our community and at the national level?
At both levels, I think there are a lot of things being done to make people aware. The thing is, are people listening? Bahamians are are a set of people like this. If it doesn't affect me directly, then I don't care. And we need to do away with that type of attitude. I just want to say one thing too. Bahamians tend to jump from doctor to doctor. That's absolute foolishness, because you don't get to know your doctor, so you don't develop a good rapport and you don't feel comfortable. Hence, they don't discuss their deepest inner problems with their doctor. Find a doctor that you like, that's competent and knowledgeable, and stick with him or her and get to know them so you can feel comfortable in talking about everything with that doctor. And your doctor is not going to lead you wrong. Remember, we are professionals. We are sworn to save lives. We are sworn to be there for you at any cost. And so we will do whatever it takes to make sure that you remain in good health and that you're treated properly, equally, and humanely. Any other questions, Ms. Moss?
Yes, I wanted to get to this comment by Ms. Wild Goose. I'm going to pull it up right now. She's talking about a fundraiser she wants persons to be aware of. There's a fundraiser. Please support a fundraiser drive tomorrow, 12 to 4 at Shell gas station. Get your gas and donate to the Cancer Society and win prizes. And let me get to Dr. Chin as well. I'm going to get to a comment after this. Want to ask you about testing and checkups. What advice or what guidance would you give to, I know you spoke about it, I know you talked about it, you touched on it, but what advice or guidance would you give to individuals about getting regular checkups for breast cancer screening? What advice, what guidance would you give, especially for those who may have a little bit of anxiety? I know you said the doctors are our friends, but what advice can you give to them?
Again, like I said earlier, if you know Grammy had it, Auntie had it, whatever, then you should proceed to the doctor to have a screening, have your breast examined, and have either a mammogram or an ultrasound to determine if there's anything wrong. Have your annual blood test to determine if anything else is going on. Discuss it with your doctor. Discuss your fears. Discuss all your anxieties with the doctor so he can alleviate your fears and let you know what you need to know in terms of if a lump is detected, what is the next step? What do we do from here? If this is malignant, then what do we do? If it's benign, then what do we do? So again, like I said, get to know your doctor, feel comfortable with your doctor so that you can ask any questions and have your doctor answer your questions and discuss it with you. There's no need to be afraid. And like I said, not every lump that's detected in the breast is cancerous.
Thank you. Thank you for sharing that as well. Dr. Chin is saying everyone needs to get their regular screenings for cancer, blood pressure, diabetes, and other chronic diseases, and get their vaccines for pneumonia, cervical cancer, COVID-19 and flu, etc., recommended by their doctor. And you talked about women who are dying from cervical cancer as well, which can be prevented by screenings, their regular screening. But I want to also ask you about advice. What advice would you give to individuals who would have conducted a breast self-examination maybe at home, and they may have they're thinking, I've found something significant. What advice would you give them in terms of coming forward to see that? What advice would you give them?
Well, again, I would like to reiterate that if you examine your breasts and you find any changes in the contour of the breast, the size of the breast, the shape of the breast, the topography or the appearance of the breast skin, or anything coming out of the nipple that you're not comfortable with, see your doctor, okay? Discuss it with him, and he will further examine you and have some tests done. Like I said, a mammogram, depending on your age, an ultrasound, depending on your age, or both, or a breast MRI. And if a lump is detected or some abnormality is detected, he may further recommend a biopsy to get some cells to see if they're malignant cells. If there are no malignant cells, then he may advise you to have follow-up either every 3, 6 months, or a year. But if there are malignant cells, then he will discuss your options with you and make a referral for you to see the oncologist, who will discuss your options, maybe surgical, maybe chemotherapy, maybe radiation, with you. And then you can make the choices from there.
And Dr. Fox, as we wind down, are there any additional comments you would like to add? Anything else you think is, you would like to share with persons?
Yes, a healthy lifestyle, a healthy diet, reduce fat, reduce alcohol and tobacco intake. If you're overweight, try to lose weight. If you're over the age of 35, stay away from hormonal therapy. And just think positively and try to be happy. I find that mood and psyche also plays a role in general health. And I say that because when I was diagnosed with cancer, I had an upbeat, positive attitude. And I think that helped me through the ordeal, because being diagnosed with cancer and taking chemo and this and that and the next, and a lot of negative people come around you and say a bunch of negative foolishness. And you have to learn to block that and stay positive and live in hope. And this helps you to recover. This helps the time during the chemo to go by faster. And another thing I like to say, if you're detected to have cancer, act on it quickly. That's what I did. It doesn't set in. It doesn't cause the depression. You don't have time to dwell on it. Just do what you have to do and get it over with. And then just get back to your normal life and recovery. And again, I would like to reiterate, just because you're diagnosed with cancer, it does not mean you're going to die, okay? A lot of people go on to live a normal, healthy life, like me. The C word does not equate to death.
Absolutely, absolutely. And again, I want to, say that, I learned today. I mean, you shared some helpful information. You talk about the fact that after 35, no hormone therapy, right?
Yes.
After a certain age, you shouldn't be on certain contraceptives. That's the ones with the hormones, right?
Yes.
Wow. And then you're at risk if you have if you give childbirth, have a child after 40.
Yes.
Wow. And even men are at risk as well, so they also need to get their screening as well, because we normally just think about women.
And I encourage men to do breast self-exam as well.
Oh, wow.
Yep.
Wow.
To see if they develop lumps or tumors in their breast as well. And if they do, they can have breast ultrasound or mammogram, depending on the size of the breast, to determine if the lump is malignant or benign.
And can you, before we close, can you just talk about those risk factors again? The
ones with the family history. Like I said, if Grammy and cousin and everybody have it, then more than likely you will get it too. So let the doctor know that you have a strong family history of breast cancer in your family. The gene mutation, if you know that mom had a Bracha gene, then you should be tested for the Bracha gene. Late childbearing, early menstruation and late menopause, obesity, increased breast density, like women with these big, humongous, dense breasts, prolonged use of oral contraceptives after a certain age, hormone replacement therapy after menopause, and excessive alcohol and tobacco use. Those are the major risk factors for breast cancer. And another little tidbit for Bahamians is, a study found that women who live in the east of New Providence are more likely to get breast cancer than women who live in the west. And it's more likely to come in the left breast than the right. Now, I
Dr.
hope
Fox, don't just drop that. Repeat that slowly, please. Repeat that again. You're dropping some heavy stuff.
Huh?
Could you repeat that, please?
Studies show that the incidence of breast cancers increase in the east, and it is more likely to occur in the left breast.
That's some heavy stuff. So more than the west.
Yeah.
More incidents in the east.
Well, I think there's a simple answer for that.
Go ahead.
People who live in the west tend to be more a little bit more affluent and have a little bit more money, so they have insurance. They are and I don't know how this can come across, but they tend to be a bit more educated, so they're more aware of the significance of screening, early detection, and they have the means to do it on a regular basis, and hence keeps the numbers low.
So it's not really an issue of location, it's more of an issue of being more consistent in terms of your screenings and being on top of, getting your tests done, your checkups. And
yes.
wow.
But they didn't say that in the study. I just put that together.
You just drawing a conclusion, right?
Yeah. No, but breast cancer is a serious issue in this town. I am always mortified and taken aback, and gets to the point where sometimes I get depressed and emotional when women present with advanced breast cancer and they have 3 young kids and a husband, and they're not gonna survive. You still give them all the options of hope, and they're not gonna survive because the cancer is too advanced. And now they're going to leave these kids behind with no mother and a husband with no wife, and a whole family that grieves the loss of them, all because they were too afraid to go and get early screening and just develop a rapport with their doctor to tell them that, look, I found this lump in my breast a few months ago and I need it checked out.
But that was an interesting case that you spoke about with the person who had the patient who had the lump, and they didn't inform you. And, after doing a search, you found it with more of an advance.
Yes, it was extremely advanced, stage 4.
Wow.
Yeah, sad case, but common.
Wow, too common.
Yes.
Yeah.
So we need to work hard to reduce these statistics, not just in breast cancer, but in all these non-communicable diseases that we see in this town, like diabetes, high blood pressure, high cholesterol, heart disease, and cancers.
Absolutely.
And HIV.
Sorry?
I said and HIV.
Absolutely. Oh yeah, absolutely. I think sometimes because of the stigma attached, persons may not feel as comfortable talking about it. But the good thing about it is it's free. Like you talk about the screenings that are free, made available to the persons on the family islands. These screenings are free. You can take advantage of those testing. I know sometimes, I know that HIV testing, they did a rollout in June. You can just go and take your test and be done. It's not even long. It's not even extensive. You just go in and come right back out.
And see, that's where education comes in, eh? If we would read more, we would be more comfortable with what is wrong with us, and we would have no problem discussing our problems with other people. Somebody else's opinion of you should not matter unless they're in your immediate family. But we as Bahamians, we tend to want to live to please everyone, and as a result, we end up pleasing nobody and end up unhappy and end up in the predicaments that we are in. But in the United States, in Europe, talking about your HIV status is just good talk for coffee. Nobody cares, and nobody is judgmental, and it's widely accepted. If you're positive, you're positive. You take your meds and you live a normal life. Whereas if you have cancer, that's usually not the case. If you're detected late, more than likely you're gonna die. Whereas with HIV, even if you're detected late and you start your meds, you can revert back to normal and live a normal, healthy life. So it's all about education and information, and being comfortable with what you read and who you are and what's being done. And it's also dependent upon the rapport that you have with your doctor, because, you know, if you have a good support system from your physician, then you can move mountains.
Yes, yes. Dr. Fox, you shared a wealth of information with us today, and I hope that, and I know, you know, that some persons have the benefit, that persons would have benefited from this talk today. And if we want to continue this talk, can we call on you, Dr. Fox? Can we reach out to you?
My job is to educate and inform.
Dr. Fox, thank you so much. Is there a page you would like to share with us?
Well, I'd like to say that you can find me at the Medicenter Collins Avenue, where I'm a general practitioner with a specialty in HIV and STDs. We do everything there. We're more like a one-on-one doctor facility, even though we're a clinic. We take time with our patients. We educate them. We provide educational materials. We have counselors. We have people that give out information. You know, it's just wonderful, marvelous, and great. That's all I can say.
And sounds like you have everything in one, because you have the counselors. Yeah, everything in one. That's excellent. So I would like to thank our viewers for listening in. Dr. Fox, I would like to thank you for, again, sharing your time with us today, and we welcome you back anytime. Thank you so much.
Thank you, and thank you, Bahamas, for listening.
And Jamaica, Ms. Pitta was listening in from Jamaica as well. Don't forget Jamaica,
Nice.
wherever else.
Thank you, Jamaica.
So I would like to thank our viewers for listening in. Like our page for future notifications of upcoming discussions. Comment under our videos. Let us know your thoughts. Let us know what you want us to talk about. You can subscribe to our YouTube channel, Can We Talk? Follow us on Instagram and Twitter using the addresses provided on our page. Thank you, and can we talk?